Good afternoon. I'm Dr. Deborah Bogan, the Director of the Allegheny County Health Department, and I welcome everyone back to our Allegheny County COVID-19 briefing. We're doing things a little differently today. The county executive, who usually begins our briefings, will not be attending this week due to a scheduling conflict. So today, it's just me. So let's start with what we know and don't know about the Omicron variant. Based on preliminary studies, it appears that Omicron variant is highly contagious. It has already been found in over 50 countries and 20 U.S. states. However, we don't yet know the clinical severity of Omicron. While there are hopeful reports that it may present with generally mild symptoms, we simply don't have enough data yet to make that conclusion. It's also too soon to determine the effectiveness of the currently available vaccines against the Omicron variant. Although one study suggests that the Pfizer vaccine, especially for those with a booster dose, does offer some protection. As more data are collected and analyzed over the coming weeks, we will have a clearer picture of the challenges Omicron presents. It has not yet been detected in Allegheny County. As for surveillance, at least 4% of infections are undergoing genomic sequencing by commercial laboratories in our area to determine what variants are present today locally. Our cases remain nearly all Delta at this time. But no matter what the variant, cases remain high here. We are currently averaging about 650 new cases a day. About 1% of our cases are reinfections. Our test positivity rate is increasing. The 7-day rolling PCR positivity rate is 13.4%, nearly as high as the peak last winter of 14.5%. Hospitalizations are also up, mostly among the unvaccinated. As reported by our local health systems, the hospitals are very busy. We continue to report too many COVID-related deaths. Today, we approached and are now one death shy of a very sad milestone: 2,500 deaths from COVID in Allegheny County. Since June, nearly 500 county residents have died from COVID. And most tragic is that nearly all of these deaths were preventable with vaccines. I don't expect the situation to improve soon. I anticipate cases will remain high as we move into the holidays and the new year. How challenging the winter will be here depends on several factors, mostly the choices we make and how we behave in the coming weeks. The most important thing we can do is to get vaccinated. So if you're unvaccinated, now is the time to get your first vaccine. If you're fully vaccinated, now's the time to go get your booster. If you have a child 5 or under, now is the time to protect them and others from this virus by getting them vaccinated. Now is the time. Please don't wait any longer. Vaccines save lives. We are in high transmission level here in our county, which means that everyone should be wearing a mask in public indoor settings. I'll remind everyone that masks are only effective when worn properly. That is, covering the nose and mouth without gaps. Please also maintain physical distancing when inside, wash your hands regularly, and if you're sick, stay home and get tested. And limit the size of social get-togethers if you can. The health department continues to work with many vaccine partners across the county to get shots to everyone who wants and needs one. We have been asked about large-scale clinics like we held in the winter and spring. We are not currently planning large clinics in our area, but the health department has and will continue to hold smaller events across the county. Also, our downtown immunization clinic on Cherry Way is open and busy. We have every COVID vaccine and booster available for anyone who wants them. We also offer influenza vaccine and all childhood and travel vaccines. We prefer you call for an appointment at 412-578-8062, but walk-ins are also accepted. So please schedule or bring your entire family. We are ready for you down at the immunization clinic. If you're homebound and can't travel to get a COVID vaccine, please contact your health insurer or call 211. As for seniors, as we did for initial vaccinations, we and other providers are returning to senior buildings to offer on-site booster doses and influenza vaccines. Speaking of influenza vaccines, I remind everyone to go get your flu shot. We have had over 500 cases of influenza in the county already, most in the past month, which is a return to our pre-pandemic levels of influenza. Before we move on to questions, I have a couple of quick announcements about our reporting of COVID-19 data to the public. First, the COVID dashboard is back online and updating daily. Also, as we approach the new year, the Health Department is considering changes to the frequency and details of our COVID-19 updates. I will provide specifics when we meet again on December 22nd. The planned changes are designed to include information such as breakthrough data and reinfections. We continue to hear from employers that some employers are asking for a negative COVID test to return to work. According to the CDC and the Pennsylvania Department of Health, this is both unnecessary and inappropriate for most cases. People can test positive for a couple of months after having COVID, but that does not mean that they continue to spread the virus. So we have placed a document on our COVID website that provides back to work guidance. People can print it and share it with their employer if you're asked for a negative COVID test to return to work. Finally, let me address the pronunciation conundrum. Omicron or Omicron. According to the Merriam-Webster dictionary, if you're speaking American English, it's pronounced Omicron, but if you're speaking the Queen's English, it's pronounced Omicron. Tomato, tomato. With that, I wish everyone a healthy and happy holiday season. Please be mindful of your actions and how they might affect you, your loved ones, and your communities. And as always, be safe and be kind.
The first question that we have today is from the Pittsburgh Business Times. Have there been any cases of Omicron, I'm struggling to pronounce it, discovered in the Pittsburgh region yet?
Depends, Amy, if you want to talk the Queen's English or American English. So really, as I've said, we do not currently have any cases of Omicron here in Allegheny County that we're aware of, but really it's just a matter of time, likely in the next, soon.
The next questions that we have regarding vaccine demand come from the Post-Gazette. But before I ask you these questions, in your remarks where you were talking about eligibility, I believe that you referenced that children 5 or under instead of 5 or older.
Yes, 5 and older. I'm sorry for that misspeak. Thank you for catching that.
The first question, has the county seen an increase in demand for first doses since the discovery of the Omicron variant? Has demand for the pediatric vaccine remained high, or has it tapered off after the initial rush?
So there has been a slight increase in the number of individuals receiving the first dose of the vaccine as of the week of 12/4. We also saw an increase in boosters that same week after several weeks of decline. So it seems like perhaps that has encouraged some people to get vaccinated. However, the demand for vaccines for the 5 to 9 and 10 to 19-year-olds seems to have tapered off in the past week, and we're really hoping to see an increase in that again.
How many pediatric doses have been given in Allegheny County?
So 5 to 9-year-olds, about 17,000 individuals have received a vaccine, and that's about 27% of that age group that's at least partially vaccinated. And for the 10 to 19-year-olds, about 71,000 doses have been, or individuals have received at least one vaccine, and that's about 54% that are at least partially or fully vaccinated in that group.
This next question is from the Pittsburgh Business Times. In Allegheny County, as of today, the state's dashboard says ICU capacity is down to levels it hasn't seen since a year ago, along with the number of COVID patients hospitalized and the number of COVID patients on ventilators. There are also longer waits in some places for treatment. Given the staffing challenges at healthcare facilities across the region, along with the rise in COVID cases plus seasonal flu and normal traffic, has the county's hospital capacity being stretched to a critical point? Has the county's hospital capacity been stretched to a critical point? And if so, what can be done about it?
Well, as I've said many times at these briefings, these questions about hospital capacity are really best answered by hospitals. They all have contingency planning, ways to expand bed capacity, and ways to prioritize patients. So I would ask that you ask them directly about their capacity. And again, we do have we're very fortunate in that we have a lot of hospital systems here in our community that provide amazing services to all of us.
This next question is from the Post-Gazette. Is there any indication that part of the county's recent surge is coming from Thanksgiving gatherings?
We see the same thing, and we have for a long time. There's no one source of infections. As we know, we have community spread, which means that you can pick this virus up in many, many places. So cases report workplace, home, transmission in the home, at schools, in sporting events, at concerts, family dinners, family friend dinners, et cetera. So not one source, but really it runs the gamut.
And this final question is also from the Post-Gazette. With the state health department's shift to weekly updates, does the county still intend on updating on weekends?
So as I alluded to in my comments already, we are making some changes, but we haven't finalized our plans yet. We really want to remain responsive to what's happening in our community specifically, but we have been doing this for a long time. It's been 2 years now. And we also know that the daily numbers are not nearly as informative as looking at a week at a time and looking at those trends. I'm also weighing the fact that I'm cognizant the demands of daily reporting have on our health department staff. So we're working on a plan with all those things in mind, and we'll bring that to you at our next briefing on December 22nd. So with that, I think that was the last question. Thank you all for attending today.
Thank you for joining us. Our next briefing is Wednesday, December 22nd at 4 p.m.